in general, there are certain categories of risk factors which predispose patients to more disease higher up in the chain, which is like smokers. Smokers have a high risk of peripheral arterial disease, but they get their disease they get disease in the bigger blood vessels in the abdomen and the groin regions. There are three categories of patients that develop very disease very far down in the leg, including elderly, usually over 80, patients with diabetes mellitus, and patients with chronic kidney disease. There's several reasons why patients with chronic kidney disease develop these blockages. It has to do with a high phosphate level, high homocysteine level. Even if they're on dialysis and they're getting good dialysis, they get a particular type of disease with calcifications, these chronic hard like rocks forming within the blood vessels in the lower part of the leg. The reason why that's of concern is because it's much easier to treat larger blood vessels. But as you get small, the blood vessels get smaller and smaller, they can block up much easier. And therefore, a patient who presents with peripheral arterial disease in general only has a 5% risk of losing their limb over the next 5 years. But a patient who has kidney disease and presents with limb ischemia, in other words, they have severe disease, they may actually have a 50% 1 year limb loss rate. So they really have to be treated. It also, it's not just a importance for saving the limb. Patients who present with chronic kidney disease that have blockages in their legs are also at high risk of developing blockages in their heart. So therefore, you have to identify those patients right away and treat them, and that, because of the heart issue.